Hi, I am Shanmugapriya, working as a lecturer in SNS College of Allied Health Science. Today we are going to see about epidural anesthesia. So, epidural anesthesia is also known as extradural or peridural block. It is a regional anesthesia that blocks pain in a particular region of the body. Anesthetic agent is introduced directly to the epidural space between L4 and L5. The goal of epidural is to provide analgesia, which leads to total lack of feeling. Epidural blocks the nerve impulses from the lower spinal segments. This results in decreased sensation in the lower half of the body. Indications: all operations below diaphragm. It may be used in poor risk patients, cardiac diseases, pulmonary diseases, metabolic disturbances, when GA is contraindicated, when spinal anesthesia is contraindicated, post operative pain management, and painless labor. Epidural needles. The most commonly used epidural needle is Tauhi needle. It has a blunt bevel with curve of 15 to 30 degree at tip. This curved tip is called as Huber tip. Other examples of epidural needles are Crawford, straight blunt bevel with no curve. Weiss, it is winged. Technique: it is given in sitting or lateral position. Usually, epidural space is encountered at 4 to 5 cm from skin. It has negative pressure in 80% individuals. Loss of resistance technique. It is commonly used technique. Once the needle prises the ligamentum flavum, there is a sudden loss of resistance, and the syringe filled with air or saline will be felt literally sucked in epidural space. Hanging drop technique. It is hardly used technique. If a drop of saline is placed in the hub of the needle, it will be sucked in due to negative pressure once the needle is in epidural space. Once the needle is confirmed in epidural space, a test dose of 2 to 3 ml of hyperbaric lignocaine with adrenaline is given. And if in 5 minutes there is no evidence of either spinal block or intravascular injection, further doses can be given. Epidural catheter is passed through the needle. 3 to 4 cm of the catheter should be in epidural space. A microfilter is attached to the catheter to prevent contamination. The onset of the effect takes place in 15 to 20 minutes. Site of action of the drug. It acts on anterior and posterior nerve roots, mixed spinal nerves. Drug diffuses through dura and arachnoid and inhibits descending pathways in spinal cord. Drugs used for epidural anesthesia. The first one is local anesthetic. Usually 2 to 3 ml of local anesthetic is required for blocking one segment. Therefore, normally 15 to 20 ml of drug is required. Lignocaine 1.2%, bupivacaine 0.625 to 0.5%, ropivacaine 0.1 to 1%, levobupivacaine 0.1 to 5 to 0.75%. Ropivacaine is most preferred because of high safety profile. Opioids, we use commonly morphine and fentanyl. Morphine 4 to 6 mg, onset 30 minutes, duration 12 to 16 minutes. It provides analgesia for 48 hours. Fentanyl 100 mcg, onset 10 minutes, duration 2 to 3 hours. Adjuvant drugs: clonidine, dexmedetomidine, neostigmine, ketamine. Liposomal bupivacaine, it can produce longer lasting analgesia. Factors affecting the spread of epidural block: volume of the drug, age, gravity, intra-abdominal tumors, pregnancy, level of injection, length of vertebral column, concentration of local anesthetic. Similarly, the factors that affects the onset and duration of block are dose and concentration, addition of soda bicarbonate, type of nerve fiber, frequency of nerve stimulation, addition of vasoconstrictors. Advantages of epidural over spinal anesthesia: it is less hypotension, no post-operative headache. By giving top-up doses through catheter, level of block and duration of anesthetic can be changed. Disadvantages of epidural over spinal anesthesia: it causes inadequate block, higher chances of total spinal, dilated pupules, accidental dural puncture, more chances of infectious complications, higher chances of local anesthetic toxicity, higher incidence of neuropathy, intraocular hemorrhage, higher incidence of acute back pain, catheter related complications, more expensive. Thank you.